2 out of 3 people aren't actually brushing their teeth properly. And the funny thing is, everyone thinks that they are doing it really, really well. The giveaway signs that you're not brushing your teeth as well as you could be is bleeding gums. This is by far the most common. When you spit out in the morning, you see a little bit of red in the sink, don't ignore it. I know it's painless, I know that it probably happens every single day, but just don't ignore it because it's an early sign of gum disease. Other common problems are excessive tooth wear from brushing a little bit too hard, and problems when the gum actually comes away from the tooth. Now this is irreversible, so once this happens, there's very little that you can do to actually get it back. Now the only reason that we brush our teeth is to get rid of plaque, which causes gum disease. Plaque is very soft, and if you run your finger across your tooth with your fingernail, then you can see the plaque underneath there. And all plaque is just loads of bacteria which produces toxins, irritates the gums and causes your gums to bleed. So if your gums bleed, then buying a mouthwash isn't actually going to help. Now I know there's some mouthwashes that advertise saying that if your gums are bleeding, use this mouthwash, but to be honest, it's just not going to work. You need to understand the core problem, and the only way you can do this is by seeing a professional. See a dentist, see a hygienist, get someone to have a look and they can offer you advice, because the advice that I give my patients is very specific to them. Some may have implants, some may have bridges, some may have teeth which are crowded and they need special ways to clean their teeth, and this is very specific advice, and you can't just get this from a generic video or an advert or anything like that. So we figured out that plaque is the main problem and this is what causes the gum disease. So how do you brush correctly? You can use an electric toothbrush, and I do tend to recommend these. I recommend an Oral-B because it's got a small round head which is roughly the size of a tooth. What you want to do is remove all this soft plaque from the area where the tooth and the gum meet. And if you just concentrate on this one little thing, then your teeth will just suddenly become a lot healthier. The amount of bleeding will go down dramatically. Some people bleed from in between the teeth, and you also do need to floss, but I think if you've got a really good toothbrush technique, 90% of the bleeding will just go away. If you're concerned about the health of your gums, if you think your teeth are getting a little bit too long, you're getting some sensitivity from your teeth, then you should really go and see a dentist. And luckily, dentistry isn't like it used to be. It shouldn't be a scary experience. Come and see me, and I'll be able to tell you what's going on, so at least you understand your mouth and you can get on top of these things.